take the clothes off my back.
What's going on, YouTube? This is Nurse Cal, and today we're going to be talking about beta blockers. But before we get into it, go ahead and hit that like, share, and subscribe button at the bottom. Also, be sure to stick around to the end of the video. We're going to have a lot of information towards the end. It's going to have the contraindications with beta blockers. We're going to have medication that you can't take it with, and what are the side effects of the medication. So stay tuned. So what exactly is a beta blocker? A beta blocker is a adrenergic blocking agent. So adrenergic sounds familiar, right? It sounds almost like adrenaline. So that lets us know that it's going to be blocking adrenaline. So we all know what adrenaline does to the body. It's going to give us that excitability. It's going to give us that action. Your heart rate is going to increase. It's going to skyrocket. So just think about adrenaline. Adrenaline gives us that extra edge. Okay? So if we're going to be blocking that excitability, we're going to be blocking that action. So instead of your heart rate going up, it is going down. So when your heart rate goes down, it's going to decrease the force that is going to be putting on your cardiovascular system. So we know that your blood pressure is a part of that cardiovascular system. So when your heart rate goes down, your blood pressure decreases. Now, what is the best way to recognize and remember beta blockers when you see them on a test or if you see the actual medication? LOL. Laughing out loud. Just remember to laugh. Okay? That's it. That is the perfect way to remember a beta blocker. Now, with that out the way, so now that we know what a beta blocker is and what it does and how it affects the blood pressure and what it's doing to the heart. So now it's time to break it down even further. So now you have beta 1 and you have beta 2. So now we're going to go right into metoprolol. So that is the prototype. That is going to be your go-to. It's selective. It only affects beta 1. And that, like we said earlier, is focused on the heart. Now with beta 2, remember that is affecting your respirations. Not necessarily your respirations, but it's affecting the smooth muscle inside of your bronchioles. So remember with adrenaline, so this all is surrounding adrenaline. So with adrenaline, I'm going to need my lungs. I'm going to need to be able to breathe. So if I'm blocking adrenaline, with adrenaline, it bronchodilates. So if I'm blocking that, then I'm causing bronchoconstriction. And we don't want that with our patients who are compromised, like COPD patients or asthma patients who actually need help. They need bronchodilation. They need to be able to breathe. So propranolol is non-selective. It binds with a high affinity for both beta 1 and beta 2. So if you see propranolol on a test and the patient has COPD or patient has asthma, this is a medication that you do not want to give. However, if you see metoprolol, we're only affecting beta 1. We're only affecting the heart. So if they have any respiratory issues, it's not going to affect that. It's not going to have a direct effect on it. Contraindications. So you don't want to give this to patients who are symptomatic bradycardia, have AV blocks, or have decompensated heart failure. So along with COPD and asthma, those are other contraindications that you want to be mindful of. Now, finally, we're going to talk about safety. We're going to talk about safety, which the NCLEX loves to give safety and priority questions. So with metoprolol, since it is a drug that lowers the blood pressure, you're going to educate your patient, say they're discharging home or they're self-medicating or you're giving patient teaching. You want to let them know to check their blood pressure prior to administration. You can also be mindful of quick position changes and to rise slowly. That is a safety issue and that is a safety question because they are taking a blood pressure medication. And that will be a question I promise you will run into a lot, not only with metoprolol, not only with other beta blockers, but you're going to run into that with a lot of blood pressure medication. So be mindful of orthostatic hypotension. Now, finally, we're going to talk about safety. We're going to talk about safety, which the NCLEX loves to give safety and priority questions. So with metoprolol, since it is a drug that lowers the blood pressure, you're going to educate your patient, say they're discharging home or they're self-medicating or you're giving patient teaching. You want to let them know to check their blood pressure prior to administration. You can also be mindful of quick position changes and to rise slowly. That is a safety issue and that is a safety question because they are taking a blood pressure medication. And that will be a question I promise you will run into a lot, not only with metoprolol, not only with other beta blockers, but you're going to run into that with a lot of blood pressure medication. So be mindful of orthostatic hypotension. With that being said, that's brought you to the end of my video. For more content, please hit the subscribe button down at the bottom.
You take the clothes off